Is everybody aware of what happens when you have a smear?
Especially not me. Not me.
What
I've seen that.
What I've got here is I've taken it out of a pelvis, but basically it's a uterus with the cervix on the top. So when you look inside the vagina, that's what you see. And to take a smear, we put the brush inside like that, and we rotate it 5 times to 360 degrees. We then pop the brush head comes off the brush, and the brush goes into the pot. The pot's got fluid which has preservative fluid in it, and all the cells from the cervix are on the brush and go into the fluid. Okay. When the pot goes to the lab take the cells out of the fluid and put the cells onto a slide, and they then look at the slide under a microscope and they look at the cells. So that's the process of having a smear. As you say, a number of smears come back abnormal, and we've now in Ashton, Tameside, got a direct referral pathway, so that anybody who has a normal smear gets a letter to tell them that the smear is normal. Anyone who has an abnormal smear gets referred directly by the lab to our clinic and have their treatment or whatever. So it is a direct referral, and the reports will tell the GP or the practice nurse this patient has been directly referred for colposcopy. This therefore takes out of the hands of the GPs and practice nurses the need to refer. It means that 100% of the patients who have abnormal smears are referred to the hospital, and no one's missed. It also quickens the process up. Most GPs are very quick at referring, but some can take their time, so it means that there's a seamless structure. The only problem in that, and something that I'd quite like more practice nurses to try and do, is tell the patients that when they are having their smear, if it's abnormal, they're going to get an appointment from the hospital for a colposcopy. And therefore it's also important that the patient may want to know why, what a colposcopy is, and what we do when we do colposcopy.
Presumably you send information about that though to the patient in advance of the appointment?
Yes, the patient gets a letter from the cervical screening programme telling them that their smear is abnormal and they have been referred for colposcopy. And we also send out the appointment with an information leaflet. That it's the standard NHS screening programme leaflet on colposcopy. If they may have what we call see and treat, which I'll come on to, then we sometimes send them an information sheet on see and treat. Can I just get my so essentially the reasons why you'd be referred for colposcopy, is it on there?
Yeah, it's super.
Yeah. Smear can be normal, borderline, and then mild, what we call dyskaryosis, or mildly abnormal, Moderate, severe, severe, query, invasion, which means query cancer, or inadequate. That's really the various possibilities on a smear. There are a few other rarities, but I'll not talk about those. But basically, if you have 3 borderline, 6 months apart, so if you have one borderline, the report will say have another one in 6 months' time. If you have 3 in a row, then you get referred for colposcopy. If you have any of these on a single smear, you get referred for colposcopy. If you have a severe query cancer, then you are referred under the 2-week cancer rule, so you're seen within 2 weeks and dealt with appropriately. Inadequate, it'll usually suggest repeating. Again, recurrent inadequates get referred for colposcopy. The lab knows this and will advise on the smear result, this patient has been referred for colposcopy.